Healthcare is one of the most important fields AI is going to transform. Last year, we announced our work on diabetic retinopathy, which is a leading cause of blindness, and we use deep learning to help doctors diagnose it earlier. And we've been running field trials since then at Aravind and Sankara hospitals in India, and the field trials are going really well. We are bringing expert diagnosis to places where trained doctors are scarce. It turned out, using the same retinal scans, there were things which humans quite didn't know to look for, but our AI systems offered more insights. Your same eye scan turns out holds information with which we can predict the 5-year risk of you having an adverse cardiovascular event, heart attack or strokes. So to me, the interesting thing is that more than what doctors could find in these eye scans, the machine learning systems offered newer insights. This could be the basis for a new non-invasive way to detect cardiovascular risk. And we just published the research, and we are going to be working to bring this to field trials with our partners. Another area where AI can help is to actually help doctors predict medical events. Turns out doctors have a lot of difficult decisions to make, and for them, getting advance notice, say 24 to 48 hours before a patient is likely to get very sick, has a tremendous difference in the outcome. And so we've put our machine learning systems to work. We've been working with our partners using de-identified medical records. And it turns out if you go and analyze over 100,000 data points per patient, more than any single doctor could analyze, we can actually quantitatively predict the chance of readmission 24 to 48 hours before, earlier than traditional methods. It gives doctors more time to act. We are publishing our paper on this later today, and we are looking forward to partnering with hospitals and medical institutions.
What you say in the book is there's so many interesting things. I'm going to start at the highest level where you say aging is a disease. Let's talk about that.
Well, so aging as a disease is a shock to most people because we thought we knew what aging was. But I paint the pictures of what the future looks like in the very near future and far future, and what that means for the world, good and bad. And so if you want a view of that, it's in there. What I think is going to happen, and I'm right on the cutting edge, I see things that most people don't, sometimes years ahead. So consider that. What I see coming is that there are drugs that are in development that could be on the market within the next year or two that look like they would slow down aging. The problem is that aging isn't a disease, at least based on the regulatory authorities anywhere in the world. That may change in the next 10 years too. There's a lot of push from grassroots as well as from the top down. So that's probably, one country starts doing it, everyone's going to follow because it's going to be great for that country. And something like metformin is only a couple of cents a pill, so it's not going to bankrupt a nation trying to prevent diseases like heart disease and cancer. Mm-hmm. So I think within 10 years you'll have a blood test, you'll have your biological age identified. If you're above a certain age, let's say it's 50, you can be prescribed metformin and some of these other things, and that'll be quite acceptable. Just the same way we now have cholesterol drugs to prevent something. Once you know it's safe enough and it's cheap enough, then things become adopted. And I think it'll be quite normal in 10 years for people to be working on slowing their aging, whereas now... I'll tell you that it's surprisingly simple to reset the age of tissues and organs once you know how to do it. I would put it to you that any high school student could do it right now in their kitchen. So it's similar to gene, CRISPR or molecular biology. It can be turned into a kit, can be turned into a pill.
Hi, I'm Tony Robbins, one of the co-founders of Fountain Life.
And Peter Diamandis here, also the co-founder.
Listen, we're reaching out to you today because there's a crisis in healthcare. You and I both know it. We all do. The costs are soaring. And the results are getting weaker and weaker for people. People wait until it's too late, oftentimes, to be helped. And people live in a lot of fear about cancer, heart disease, about all these different aspects that can affect our lives today. And so we decided over the last 3 years to interview 150 of the greatest scientists, Nobel laureates, regenerative doctors, and find out what technology is there to find things when they're small and handle them now, that it's truly available. And what's the technology that could help you optimize your health and vitality and strength at any age. And in doing so, we came across some tools that are amazing, and we found out something. The breakthroughs in technology and health usually take about 30 years, 25 to 30 years, to get to your physician. And what we want to do is circumvent that, bring it directly to people right now that are proactive and want to change their lives. So if that's something of interest to you, we really want you to take a look into what the resources we have here at Fountain Life.
We've built centers around the United States, so we're building it globally as well. These centers are, think of them as the Apple stores for your health. You go, and in 4 hours, we digitize you. We upload you 150 gigabytes of data. It's a full body MRI. It's an AI-enabled coronary CT, a DEXA scan, your genomics, your executive blood work, a GRAIL cancer test. The goal here is to detect any disease at stage 0, at stage 1, while you can take action for it, before it becomes devastating. You know, we're all optimists about our health. We all think we're in fantastic health. We think nothing's going on inside our bodies until that moment in time when you end up in the doctor's office or the hospital. They say, I'm sorry to tell you this, but you have. And guess what? It didn't happen that morning. It's been going on for some time. And the question is, when do you want to know? When it's too late, or when you can take action against it?
So if you're somebody that's proactive, if you're somebody that doesn't want to settle, if you want to know what's really going on, even if it's something you're not thrilled about where you can handle it immediately, or if you're somebody that just says, I want the cutting edge when it comes to increasing my energy, my strength, my vitality, and my health span, not just my lifespan. You know, you have some people, do you want to live to be 100? Most people, I don't know, because their idea of that is Alzheimer's, it's being decrepit. But if you could have the same vitality and strength and live in the 80, 90, 100-year range like you were in your 50s and 60s or even 40s, that technology is here now and evolving very quickly, and we're on the cutting edge. So if that interests you, please reach out to us and discover what we can do for you at Fountain Life and Fountain Health.
A pleasure. And ultimately, our mission is to make you the CEO of your own health, to add 20 or 30 healthy, vital years onto your life, because the technology now exists to make that happen. And we're searching around the world with extraordinary physicians to deliver it to our centers and ultimately to you.
There's an old adage that says, a person with health has 1,000,000 dreams. A person without it has one. Our goal is to make sure you have those 1,000,000 dreams possible and you can execute the ones that you want with the energy you have, as opposed to the people that having to settle for the one. So thank you for listening, and we look forward to having a chance to hopefully serve you, your family, or those you care about.